Mr. President, the Affordable Care Act is working. It's working better, frankly, than many of us who were there at its inception believed it would at this early stage in its implementation. The numbers are pretty hard to argue with. You've got now upwards of 10 million people who are on either private insurance with tax credits to help them get that coverage, or are on Medicaid through different state plans. That's a big deal because in just about a year, we've reduced the number of people without insurance by 25% in this country. In my state of Connecticut, which probably has the best run exchange in the country, we've actually reduced the number of people without insurance by 50%. Better news is that quality is getting better. Some of the measurements that we most closely watch to decide whether people are getting better care, things like hospital-acquired infections and readmission rates after surgery, all going down. That's really good news. And of course, maybe the best news of all is that taxpayers are saving money. A really extraordinary leveling off of healthcare inflation. Healthcare spending never goes down from year to year, but we used to have 7 to 8% increases in spending on an annual basis. We're now seeing 2 or 3% increases. In fact, the lowest rate of increase since we started tracking healthcare spending happened in this last year. Federal taxpayers are saving, on average, $1,000 per Medicare beneficiary compared to what the Congressional Budget Office thought we would be spending when we passed the Affordable Care Act. Now, that doesn't mean that we don't have a lot of work to do, but it does mean that the conversation we should be having today is about perfecting the Affordable Care Act, making it work even better, not repealing the Affordable Care Act. And it's not just me. I've been down to the floor over and over again to make this case that the numbers simply don't lie, but the press universally, perhaps, reporting on this overwhelming avalanche of data telling us that the Affordable Care Act is working. I just literally in the 5 minutes before I came to the floor did just a quick search to see what people were saying. New York Magazine, quote, 4 new studies, Obamacare is working incredibly well. Forbes, more solid proof that Obamacare is working. Washington Post, despite the critics, Obamacare works. Business Insider, major new study, says Obamacare is working. Rolling Stone, Obamacare, it's working. I could do a full 10 minutes just on the headlines that tell you that the Affordable Care Act is working. But instead of talking about making it work better, today we're talking again about repealing it. The House took, I think, their 56th vote to repeal all or part of the bill. And this morning, several of our colleagues unveiled a proposal to replace the Affordable Care Act. Now, I give my colleagues credit. It's been 5 years, and this is the first time we've seen even a memo on what would be this replacement that we've been hearing a lot about. But it's still just a memo as far as I can tell. We don't have any legislative text or any CBO score. But I wanted to come down to the floor and just talk for a minute about what this replacement would mean. The replacement memo that we looked at this morning, offered up by 2 of our Senate colleagues and 1 of our House colleagues, all really thoughtful legislators on this issue. I want to give them credit for putting this on the table. It would really mean the retraction of health care coverage for millions of Americans. People who have finally been able to afford health care because of the Affordable Care Act now would go back onto the rolls of the uninsured. Why? Well, for 2 major reasons. One, their plan reduces the number of people that would be eligible for the subsidies by millions, and then greatly reduces the amount of the subsidy. They admit that that's the best way to get coverage, so we're not arguing any longer, at least, over whether providing tax credits in order for people to buy private insurance is the right way to go about expanding coverage. They just want to lessen the amount of money that we're providing in tax credits, meaning a lot less people are going to get insured. So you'd have millions and millions of people who would go back onto the rolls of the uninsured, people who would once again be at the mercy of insurance companies, who would lose everything, their house, their savings, their car, just because their kid got sick. But the second thing that it does is really put insurance companies back in charge of our health care. It gets rid of the prohibition on gender rating, which is a complicated way of saying that in the old system, insurance companies charged women more just because they were women. Affordable Care Act doesn't allow that any longer, but that's where we'd go back to under this alternative. It used to be that insurance companies would say, you're only going to get a certain amount of insurance per year, and then we cut you off. Well, for a family that I know in Simsbury, Connecticut, whose son has a fairly rare blood disorder, that meant that they had to pull out of their savings every year in order to afford his expensive drugs. That discriminatory treatment would come back. And, well, the bill tries to address the issue of pre-existing conditions. It seems to say that you would have a one-time chance to get on an affordable care if you had a pre-existing condition. But if you didn't sign up in that opening moment, in that special offer, then you wouldn't be able to sign up later on. So if you got sick later on, it'd be too late for you. Or if you lost your coverage at any point, like on average 89 million Americans have over the last 3 years, you wouldn't get the chance to have insurance with a pre-existing condition at the same rate as people without pre-existing conditions. So what this bill really is about is people paying more and getting less. It's about going back to the day when people couldn't afford health care and they lost everything simply because they or a loved one, a spouse or a child, got sick. Never mind the fact that some of the pieces that I thought we all agreed on are repealed in this proposal. The donut hole is an outrage. The idea that seniors who are trying to buy prescription drugs on Medicare get a little bit of coverage, then no coverage, then a lot of coverage. Middle-income seniors can't afford that gap in coverage. Well, the Affordable Care Act effectively eliminates the donut hole, and that's saved seniors $11 billion since 2010. This memo that we've seen from the Republican side would apparently get rid of those savings, putting the donut hole back, putting millions of seniors back on the hook for all of these costs when they lose coverage. So this effort to replace the Affordable Care Act is a giant step backwards for millions of American families. And here's the conversation that we should be having. We should be talking about how to make this law work even better. It's a major concession, frankly, from the Republicans that tax credits are the appropriate way to get people more insurance. It's a concession that we should be at least addressing the issue of discrimination against sick people. But the protection they're offering is minimal, and the expense that would be passed on to seniors, families, hardworking Americans is immense. So I'm looking forward to seeing this introduced as a piece of legislation. I'm looking forward to seeing the CBO score on it. Clearly, the American people don't want us to have this debate over repeal any longer. They're sick and tired of it. They want us to be talking about creating jobs, protecting this country, making college more affordable, and making small, meaningful changes to the Affordable Care Act to make it work even better. The data doesn't lie. The numbers don't lie. The increasing stories of people all across this country who are benefiting from the Affordable Care Act don't lie. The Affordable Care Act is working. We should stop having this tired debate over repealing it and replacing it with something that is much lesser coverage for much more cost, and invest in a conversation about how to make sure that the good news continues about the Affordable Care working for millions of Americans. Mr. President, I would yield the floor and note the absence of a quorum.